Hello, I'm Jean Pete, and I welcome you back to our show, Better Living. Better Living is brought to you by the Homestead Hope Foundation and is sponsored by Homestead Hospice, where commitment to education and premier hospice care helps patients and families through life's most important journey. Thank you for joining me again this week. I always feel blessed to be here, and if you're listening to me and you're back again, I really appreciate it. This week I have another co-host, Allison Finley. Allison, welcome, and thank you for joining me on the show today.
Thanks so much, Jeannie. I'm glad to be here.
Well, I'm glad you're here too. We have another great guest in store, so folks, get your pen, get your paper, coffee, Coke, whatever it is you like to drink while you're listening to me talk and ask questions and educate you about important health issues. We have Dr. Mumtaz Bashir. Dr. Bashir, welcome. Thank you for joining me today.
Thanks for having me. I appreciate it.
I'm excited to have you because March is Save Your Vision Month. Yeah. So we're going to learn how to do that and so much more about the eye. I hear that all I have to say is the word eye and you're just going to go.
Okay, you can say so.
Why don't we start, first of all, why don't you introduce yourself and tell us who you work for and how you got into this field?
Okay, awesome. Well, I'm an optometrist, an eye doctor. I do primary eye care. My husband and I started this practice about 11 years ago, and I work in North Atlanta area, Duluth, Suwanee, Hamilton Mill area. I've been in practice for 12 years. I've been wearing glasses since I was 8, so it kind of came naturally.
Okay, we're definitely going to talk about eyes and optometry and all kinds of symptoms and diagnoses, but first I really want to know, how do you live with your husband and then work with him all day?
I'll tell you my secret. We never work in the same place at the same time. We have 3 offices, so we don't work together.
You put the blinders on during the day. Okay, I'm only teasing. That's funny. Okay, so you've been in business for 12 years, and it's UNM Family Eye Care, and you have 3 offices throughout Greater Atlanta. And for those of you listening, I know I say it every week, we're going to have to get someone on the show from Phoenix next time or New Orleans, but good information no matter where the optometrist is. And today, Dr. Bashir is from Georgia in a town called Suwanee in northeast Georgia. However, please, if you're from Arizona or New Orleans or Gulf South or Mississippi, anywhere else we're airing, very good information for you, and we can connect you through her office to other folks throughout the United States that would be good, and they'll give you a good referral.
Definitely.
Okay, great. So on that note, Dr. Bashir, what should people look for when choosing to go see an optometrist?
Well, it's important to make sure that your optometrist is doing a thorough and complete eye exam on your eyes. Make sure that you get a dilated exam, which means yearly a checkup in which you get drops put in your eyes, your pupils opened up, take the health of the eye looked at, have your vision checked, of course, have your visual fields checked, color vision, focusing ability. There's so many aspects of an eye exam that make it a complete checkup. So a complete checkup yearly is very important.
Now, are there different credentials for optometrists? Is there a certification or an accreditation? How do you discern one from another?
Well, as optometrists, we are primary care for the eye itself.
Okay.
So a lot of patients get confused because they don't know the difference between an optometrist, an ophthalmologist, or even an optician.
Right.
So an optician is somebody who makes glasses. An optometrist is primary care for the eye. So we do everything from diagnosing vision problems such as nearsightedness, farsightedness, testing depth perception, coordination of the eye. I prescribe eyeglasses, contacts. In some cases, we even do vision therapy, low vision rehabilitation. We test for glaucoma. We remove foreign bodies from the eye, macular degeneration.
And then you mentioned ophthalmologists.
Ophthalmologists are actually surgeons for the eye. So we refer out to ophthalmologists if you have different eye diseases that need laser treatment or cataract surgery or LASIK surgery, stuff like that. So
I learned something already, Allison, did you?
Well, just
not yet.
No.
She knows
Actually,
her stuff.
I did know that, but I'm dying to ask Dr. Bashir, because I know this from dealing with friends my age. People don't go for vision checks like they think about going for an annual exam with their general physician.
That's right.
So by the time you see them, are they usually exhibiting symptoms?
Yes, unfortunately, I think maybe we've just not done a good job in educating people about the importance of getting their eyes checked. There are so many eye diseases out there that don't show early symptoms, early signs of the condition. So without a dilated and a complete thorough eye exam, you're going to miss them. So yes, it's essential for everyone out there to get a regular eye exam once a year.
Or like
Save your
people
vision.
my age.
Right.
And my arms, my doctor said, Jeannie,
Yeah.
at some point your arms aren't going to be long enough anymore. And
Yeah.
I've been going to the dollar store, and it's time to probably come and see you, Dr.
Yeah.
Bashir.
I know the first time I saw my eye doctor, it was because I was dropping the menu on the floor in the restaurant so I could read it. But what are some of the symptoms, signs, warnings that people should be looking for that tells them it's time to go see an eye doctor?
Well, even if you don't have signs or symptoms, you should still have a regular eye
Right.
exam every year. But a lot of things that people come in telling me about, things like blurry vision, difficulty focusing, my arms aren't long enough, short arm disease.
I'm in big trouble.
You know, headaches, eye strain, double vision, flashes of light, spots in their vision, problems seeing at night, stuff like that. So
And how much does family history play into this? Because I know I have a parent with a lot of eye problems. Should that be a warning to us?
absolutely humongous diseases like glaucoma, age-related macular degeneration, diabetic retinopathy, just about every eye disease that is major and sight-threatening has some kind of family history associated with it. So it's very important, if you have a family member in it, go get your eyes checked.
Because a lot of these diseases do not show symptoms, do they?
Exactly, early on in the condition. And by the time you actually see symptoms of the condition, you've already lost a lot of vision. So it's too late in a lot of cases.
I want to go disease by disease, but first let's start simple. And maybe it's because it's all about me, but I know it's not all about me. But for your typical midlifer who is suffering from short arm disease, and if they wait too long, what are some of the ramifications of that? Is that truly a serious issue, or?
Well, you know, presbyopia, or the focusing, so reducing and going down as you get older, is more of an annoyance, I think,
Okay.
than sight threatening. It oftentimes brings people into the office, so I guess it's a pretty good thing.
Yeah, that is.
But it's not necessarily going to cause you to lose vision. If you don't take care of the problem early, odds are it's going to get worse faster.
Yeah, and that was another question because, you know, my friends, but in this age group, we'll go to Walgreens or we'll go to CVS or we'll go to the dollar store. We'll just buy a quick 1.50 or 2.0 glass. Is that a bad thing to do? Can that hurt your eyes?
Well, not necessarily. I actually tell patients to go do that all the time.
Okay.
But it depends. Like, if you don't have any other issues, which sometimes you don't really realize that you have other issues. You
Right.
could have problems seeing distance, but you don't even realize it because you've kind of adapted to how you see. So the dollar store cheaters, like I call them, work if that's the only problem that you have. But in a lot of cases, there are other compounding issues as well that you can't necessarily self-diagnose. So the cheaters don't always work for everyone.
And do they cause your eyes to get worse because maybe you don't have the right prescription?
Exactly.
They do.
Yes.
Yeah, I
I mean,
wonder.
definitely. If your prescription is wrong, you're just compounding your issues instead of helping your issues.
Okay, so folks, we all, including me, need to get to the optometrist once a year.
Yep.
And get those drops and get our eyes tested. I think by the end of the show, I'm going to have to make an appointment with you, Dr. Bashir.
Come on over.
I look like a librarian. We all want to save our vanity. I hate
you
to
know-
feel so vain, but
For those of us in this age group who are vain, you know, we have so many contact lenses out there that can help you see far and near so you don't have to wear the nasty dollar cheaters. And there's so many advances in technology and stuff to correct our issues without us looking our age.
all right, good. That's good. I'll definitely make
Can
an
we
appointment.
ask about LASIK surgery? Because everybody's big on that now. My own eye doctor told me I'm not a candidate for it.
That's a very relevant point. Not everybody is a candidate for LASIK. You know, it's on the billboards everywhere. Come have LASIK, it's going to fix everything. That's not necessarily the case. LASIK is awesome. I've actually had it done myself, but I don't always recommend it for every patient because Number one, if you have cataracts or other eye diseases, LASIK would actually make things worse for you. If you've got primarily up close issues, LASIK doesn't work that well for up close. You want to be able to have your optometrist look at your eyes and then tell you, are you a good candidate or not a good candidate? Also, some people who are a little nearsighted won't do well with LASIK either because they'll lose their up close vision. So it depends on the individual. Ask your optometrist. Just because you see it on TV doesn't mean it's necessarily right for you.
So who is the ideal candidate then?
Somebody who's highly myopic, somebody who's very nearsighted. Young people under 30 would be great. If you've got farsightedness with some astigmatism and you're young, younger people with myopia or nearsightedness tend to stabilize. They get worse very young. Like me, I started at 8.
Is that when they have those glasses that make their eyes look really big?
They make their eyes look really small.
Really small. Okay, but it's like they wear magnifying glasses.
Yes.
Okay.
Those patients are really good for LASIK.
Oh, that's wonderful
So
for them.
those ones that we can treat and fix early, then they'll have a lot of years of clear vision. But after 40, the symptoms that happen after 40 don't really do well with LASIK.
And is LASIK covered by insurance, or is that still out-of-pocket private?
It's usually primarily out-of-pocket. A lot of insurances do give you discounts on the procedure.
Because it's more cosmetic.
Exactly.
Okay.
Now, I thought of something while you were talking, and I just want to clear this up for everybody listening once and for all, because I know from talking to my friends that there is confusion. Nearsightedness and farsightedness are terms we hear all the time. And I know that I have friends who can't figure out which one means what. Can you clarify that?
Absolutely. Well, let me tell you the technical terms first. Myopia or nearsightedness is when you cannot see far. You see really well up close, but you cannot see far. Hyperopia or farsightedness is when you can see fairly decent far, but you cannot see very well at all up close. Hyperopia is a little bit of a misnomer because eventually with enough hyperopia, you can't see a darn thing far, you can't see a darn thing up close. It's really bad. But the third term, the over 40 problem that a lot of people deal with, is called presbyopia. That exhibits symptoms similar to hyperopia or farsightedness, but it is a problem of the focusing muscle in the eye. So the lens in the eye can't focus anymore because the muscle gets weak as we get older. So those are the three main terms that, we get confused.
And see, I noticed that in my 40s. When I wake up in the morning, I can't focus, but then it seems to get better throughout the day. So I'm assuming as it gets worse, it's just going to lengthen.
Right. And the thing is the muscle's really relaxed in the morning. And some people say they see really well in the morning and then it goes down because their muscle is fatigued.
Oh, okay.
Other people, they're like, my muscle just can't get going in the morning and I just need it some time to wake up. So everybody's a little different.
All right, since you're describing, like, all of us, presbyopia, what is the treatment? What do you do?
Presbyopia is you need glasses. You need some help for reading.
Because the muscle's weak.
Because the muscle's weak.
Okay.
There's really no surgical correction at this time.
And you were talking about astigmatism?
Yeah.
Can you talk about that?
Astigmatism means that your eye is shaped more like a football. So you kind of get distortion in your vision more. Your retina projects an image that is kind of crooked. And then your brain has to kind of straighten it up. 1 in 3 people have astigmatism, so it's very, very common. And again, the correction for that as well is just either glasses or contacts or some kind of visual correction.
So that's not something any surgery would be?
LASIK could correct astigmatism.
Oh, okay. Okay. And you can have that very young and live with that for a long time?
1 in 3. I mean, so many people are walking around with astigmatism. It's more prevalent like in the Hispanic population just because of the genes, but yeah, a lot of people have it.
Okay, and while we're talking about out-of-pocket expenses and what's covered and all, let's talk about the typical eye exam for people to walk into the optometrist and get checked once a year. Do you know, on average, how is that usually covered? What can people expect to have to pay?
Well, I can tell you about what's going on in our area. Most insurances do cover a comprehensive eye exam. So your insurance, either your medical, if you have a medical eye problem like diabetes, cataract, glaucoma, dry eye syndrome. These are all conditions that are very common, and they are covered through most insurances. So your comprehensive eye exam is covered if you have those problems. There are also lots of different types of vision insurance plans that also cover a regular eye exam as well. Out of pocket, you're looking at an eye exam running between $60 to $70 all the way up to $125, $150.
Okay. Just to manage folks' expectations, we like to get the
Absolutely.
information out there for people. But don't let it go, because you can catch important things like cataracts or glaucoma.
Absolutely.
And
So
even with
important.
you talking about dry eye syndrome, I do have a story, and it really is not all about me, but it was pretty scary because my eyes were very dry. So I was rubbing a lot. And all of a sudden, someone said, your right eye is drooping. And it got worse and worse, and it was summer. And it wouldn't go away. I must have had 3 different eye appointments. They all did the same kind of test, couldn't figure out what was going on. And they were throwing things around like myasthenia gravis. Scary stuff. And really what it was as simple as my eyes were dry, I were rubbing
rubbing
them,
the heck out of
and
them.
I ruined the muscle in my eyelid. So don't let that go and be like me, because it was pretty scary for about a month, wondering, is there a tumor in the back of my eye?
Absolutely.
Is this myasthenia gravis? What else did they say? Graves' disease? Not good
Yeah.
stuff. And
Yep.
it was just a little lazy muscle.
And I imagine a lot of people are rubbing their eyes right now with all the pollen.
Oh gosh, it is crazy. Atlanta is just crazy with the allergies right now. I deal with it daily, and I feel so bad for patients because they're just really suffering. Some things that I would recommend, if you're having serious problems, like you're rubbing your eyes so much that you're causing your eye to droop, you need to go see your optometrist. But in general, I recommend to my patients to, after they come from outside, wash your eyes out. You can get just some simple eye wash or saline over the counter, keep it in the refrigerator so it's nice and cool, and rinse your eyes out when you've been outside. Wash those allergens out of your eyes so that they don't sit in there and fester and cause things to get worse. Also, change your clothes, shower when you come from outside. Keep your air conditioning on, close the doors, close the windows, at least until the pollen goes down a little bit, because a lot of people are
For those of
suffering.
you who are listening from Arizona, maybe in New Orleans and Mississippi, you get what's going on in Atlanta right now. But if you're in Arizona, I don't think you can understand. When you walk outside, it's not clear. There's a layer of greenish neon yellow.
Yep.
And everything you touch, even the groceries, putting them in the car and taking them out all over my sweater, is just pure green. You touch that and your eyes are gone.
Yeah, don't touch your eye after you touch
So saline, regular saline.
Yeah, just regular saline, rinse your eyes out, keep it in the refrigerator so it's nice and cool. Cold compresses also help. But if things are really bad, go see your optometrist. There's plenty of medications that we can prescribe that'll help treat your eye problems. Another thing that patients don't always understand is that systemic meds, your Claritins, your Zyrtec, all that stuff, doesn't really work that well for the eye. So you've got to treat your ocular symptoms sometimes separately than your nasal drip and all the rest of that stuff.
I know exactly what you're talking about because I do have seasonal allergies and I do take medicines for that, but anything you take orally does not help, and the inside of my eyelids on certain days feel like sandpaper.
Okay,
That's
great.
exactly
That's
right.
when I think the wash, and as long as you mentioned the saline and keeping it in the refrigerator, because I just had this conversation with my daughters about makeup, women's makeup, mascara. People think they can keep it for years.
Yeah.
And I've heard of people who've gotten eye infections from keeping makeup on too long.
Yes, I really recommend that you throw away your eyeliner and your mascara at least once a year. If you're prone to eye infections, toss that stuff every 3 to 6 months.
I must use a lot of eyeliner and mascara because I can't imagine
know, mine doesn't last
lasting Thank you so much, Dr. Bashir. That makes me feel better.
Again, the vanity comes in, right?
I am not vain. Well, this is all great information about basic eye care. And again, an optometrist, which is a primary care physician for the eye,
Exactly.
is going to help you diagnose, treat, if you need therapy. What else am I missing here? Rehab for the eye. So it's important to go and see an optometrist once a year. And I am going to listen to my own advice because this is something, as we talked about, I went through a crazy summer thinking horrible things could be going on, and I still haven't gone to the optometrist in the 2 years since. So,
Jeannie.
so if your arms are getting too short, or if you're waking up in the morning and you can't see, it's not just because your eyes are tired. It is probably because you need a trip to the optometrist. You need to get those drops put in your ears, in your eyes. You need those pupils dilated, and you need a complete checkup of the eye, and probably some eyeglasses. And if you're like me, don't just run to Walgreens or CVS or Rite Aid or Dollar Store. Get your eyes checked, because make sure you put the right prescription on your eyes, or you could make your eyes much worse.
That's exactly right.
Okay, any lasting information that you have before we go to break on general eye care as well? And then we're going to get into talking about glaucoma and cataracts and some of the more serious eye problems that you diagnose and how people can work with you to treat those problems.
No, I think you did a great job. It's just really important to have a regular checkup every year, because sometimes you just don't realize what the problem is. Our visual system adapts. So you adapt to changes in your vision, and you may not realize you really have a problem.
And really, for a $60 eye exam, even if you can't afford the expensive glasses, get the right prescription. And then if you have to go to Walgreens, at least you know and get the right prescription.
Right.
Okay, and that's what? One dinner out, folks. So again, Dr. Bashir, I want to shout out to them where they can reach you, what your company is here in Atlanta, and for you folks in Arizona or New Orleans or Gulf Coast, you can feel free to give them a call, and they can maybe farm out and find a good optometrist or recommend somebody good in your area.
Sure. I am with U&M Family Eye Care. We're located in Walmart's in North Atlanta, Swanee, Hamilton Mill area, Commerce area. You can always reach me at Dr. Bashir at umicare.com if you want me to give you some information on other doctors in your area or local area. Or you can reach me at my office, 678-482-0572.
Now, did you say you're located at Walmart's?
Mm-hmm.
Okay, that's a great question that we didn't get to, because you wonder, you know what, is the optometrist in Walmart the same kind of optometrist that has the eye place down the street? So really, there is no difference. It's just as good going to the eye doctor in Walmart.
Actually, we are a private practice inside of Walmart.
And is that typical?
Absolutely. We are all independent doctors of optometry. So we are located inside of a Walmart, but Walmart doesn't tell us what to do. They don't tell us how to see our patients, when to see our patients, how to see our patients. So the reason that we chose this modality to practice is because it keeps our expenses low. So we are able to see more patients with better quality of care without the higher fees.
That's great, and so convenient for people, even, you know, like me, mid-40s, single mom, trying to get everything done. While you're in Walmart, you need to get your eye done, eye tested.
You know, you will do better to come inside of a Walmart to deal with emergency eye issues than you ever would be to even go to the emergency room, which people don't always know.
Wow.
Because the equipment that we have, emergency room doctors don't really have. Like, I have seen so many times where an emergency room doctor, you've got something inside the eye, and the doctor uses a Q-tip and cleans out whatever that thing is and just tears up the cornea.
Okay, for moms and grandmoms, and we're not going to be sexist here, granddads and dads taking care of their children, listen to that. That's very good information. I want to talk more about that when we come back from the break, so stay tuned. Hello, I'm Jean Pete, and I welcome you back to our show, Better Living. Better Living is brought to you by the Homestead Hope Foundation and is sponsored by Homestead Hospice, where commitment to education and premier hospice care helps patients and families through life's most important journey. We're back. I'm Jeannie Pete. Thanks for staying with us, and I'm here today again with Allison Finley, my co-host.
Hey, Jeannie.
And Dr. Mumtaz Bashir.
Hi,
Dr.
Jeannie.
Bashir, hi. Thanks for staying with me, too.
Thank you.
I do just want to kind of recap some of the things that we were talking about, in that we were talking about the importance of getting annual eye exams done from optometrists so that you can have your pupils dilated and get that drop in your eye, and make sure that you have a comprehensive exam of your eyes so that if there is serious stuff going on there, you can catch it as the optometrist. And it's important to go annually because things change over the course of 12 months.
That's exactly right, Jeannie.
And then I did want to remind the folks listening that what we talked about before was that it's really no difference to go see an optometrist within a Walmart or another supercenter versus someone who's in a standalone building.
Right.
Because you're all the same.
Right. We all have the same credentials. We've just chosen different modalities to practice. You got to be a little careful with some certain corporate entities that will rush you in and rush you out. Make sure that you are getting, like we've discussed, a comprehensive eye exam, dilation, glaucoma screening, vision checked, discussion of diseases, discussion of eye issues. So all of that stuff, as long as you're getting that every year, you're going to do good no matter where you go.
And also, the importance really, and it is important, of going to an optometrist, like per se in a Walmart, versus an emergency room if you have something in your eye.
Yeah.
And tell us again why that's so important.
They just, and I'm definitely not saying anything about emergency room doctors, but they just don't have the tools and the equipment that we have. We have specialty tools made for the eye that we use to remove foreign bodies or objects in the eye that are not evasive. Whereas a Q-tip in the eye, like we discussed a little while earlier, is going to tear up the whole top layer of the cornea. And also using numbing drops in the eye, which I've also seen with some emergency room patients that have come in to see us right after. Using too much numbing drops can actually do more damage to the eye than can help. Also, dosing issues. I've seen medical doctors who've dosed eye drops wrong. So, if at all possible, see your local optometrist.
And, that brings up another good point, too, because oftentimes, we think go straight to the ER. And, of course, if you're bleeding and you have some big thing sticking out of your eye, then it's more troublesome than just, can you get this thing out of my eye? You've got to go to the emergency room. You've got to get taken care of by a doctor and all of that. But this show is called Better Living. And the whole purpose of me coming every week, and thank you, Allison, for your help this week, and educating and informing folks about all aspects of living so that we can all have better health, is to educate before the crisis occurs. And so if you're going to the optometrist, or if you've got a slight eye, I'm trying to think of the word, irritation,
redness, burning,
or there's something in there that's not clearly sticking out and maybe going past your eye into your brain, then go and see the optometrist before hitting the ER, because even still, they could see you and you could tell them, nope, you got to go to the ER.
That's exactly right.
But they can save themselves. So again, just preparing yourself and not waiting till the crisis, or not creating a crisis when you don't have to have one.
Right.
One quick question before we move on to discussing specific eye issues. If someone does find themselves with something lodged in their eye and they know they've got to get to somebody, how do you best treat that eye? How do you hold yourself together on the car ride?
Very good question. I would probably gently cover the eye, not necessarily patching it with Band-Aids and stuff, because you could be actually pressing a foreign body into your eye. So gently covering it, you're going to be in a lot of pain. You're going to be very sensitive to light. So make sure you've got some sunglasses on, just some gentle cover over that eye to help reduce some of the pain and some of the irritation, and then just get in to see your optometrist or ophthalmologist as soon as possible.
Wonderful. What are the top 3 to 5 eye problems you see with people that come and have exams with you?
Well, one big thing that we see in our office that a lot of patients don't realize they even have is dry eye syndrome. It affects 20% of the population. And oftentimes in patients who are working in front of the computer a lot, smokers have this problem, cold allergy meds, now it's allergy season, so allergy medication can actually cause you to have dry eye. Sjogren's disease, thyroid conditions, disorders associated with LASIK, injury to the eye, all of these different causes can cause your eyes to get dry.
Do you see folks come in and see you after they've had LASIK surgery because now they have more problems with their eyes?
Yes.
I've heard of that.
Yes, definitely. It's not as much of a problem as it was 7 or 8 years ago. The technology is better, so I don't necessarily see as many dry eye issues. If we do see dry eye issues associated with LASIK, it's usually resolves itself within the first 3 to 6 months.
And they're not doing LASIK on everybody like they did in the beginning, right? They're discerning more who's appropriate and who's not appropriate.
Yeah, I actually worked for a surgeon 10 years ago when I was in California, and some scary stuff was going on. I don't think I would have necessarily done the things that were being done back then today, which is good.
You mentioned thyroid disease just a minute ago, talking about dry eye syndrome. Are there a lot of other bodily diseases that are not our eyes that can then turn around and have an effect on our eyes?
Absolutely. There's tons of them. Actually, not only thyroid, because you can get proptosis, or your eyes tend to kind of bulge out a little bit with thyroid disease, and that can cause exposure, and that can cause the eye to get dry. Also, in addition to that, hate to say it for our older listeners, is menopause. You know, it dries out your body, it dries out your eyes. So that can also cause a lot of issues as well. All different kinds of connective tissue disorders, rheumatoid arthritis, Sjogren's, all this that we're talking about, all these things can actually dry out the eye.
So what can we do to prolong eye health? Is there anything that we can do as a preventative?
Regular eye exams.
Just regular eye exams, like lotions or saline, even doing it regularly, would that help, or really nothing? Just make sure you're treated.
Yeah,
you're tested.
I would definitely not recommend just randomly doing something for everyone, because it depends on what the issue is for what the treatment would be. So a regular eye exam with your optometrist will diagnose any issues that you might possibly have, and then the treatment course is appropriate there.
Let's talk about cataracts, because I hear this a lot in my own family. Oh, you know, she's having cataract surgery. What exactly is a cataract?
A cataract is a clouding of the lens in the eye. So it's actually something that people worry about a lot, but with today's technology, having cataract surgery is not so much of a big deal. I just had my mom come in, she had cataract surgery, week and a half later, she flew back home to California. So it's not as much of a big deal as it used to be, but basically with the clouding of the lens in the eye, you start to not be able to see. So some symptoms that patients note when they've got early cataracts is glare, especially glare at night when they're driving. All the headlights get really big. Things get blurry or hazy, like they can't get the haze off. It feels like your glasses are just dirty all the time, or your vision's just kind of dirty all the time. And then eventually you start not being able to see very well.
And is there a typical age onset for cataracts?
Usually it starts in your early to mid 60s. Now, light skin, light eyes, strong family history, you're going to tend to have it even sooner. If you're outside in the sun a lot, UV damage can bring on the symptoms sooner and can bring on cataracts sooner. So usually early to mid 60s is when I first start to see it. But symptoms don't necessarily even occur till later.
When we were talking before the show, you mentioned that macular degeneration has now become huge problem, and possibly for older people.
It is now the leading cause of blindness in America over 50.
Over 50?
Over
That's
50.
young.
That's young, yeah, but it's true. The CDC actually says 1.8 million people have macular degeneration now. 3 million people by 2020. It's huge.
Why is that?
We don't really know. It affects mostly Caucasians, females, strong family history, smokers, and if you have a history of high blood pressure, again, UV light, UV damage. Those are all high-risk factors.
And for those of us with
degeneration.
light eyes and fair skin, is that even just like you were saying about cataracts, same thing with macular
Yes,
degeneration?
ma'am.
Really?
Yes,
So
ma'am.
what can we do? I'm going to ask again for preventative measures.
Well, in this case, protect your eyes from the sun. Wear full UV protection. Wear sunglasses when you're outside in the sun. There are also multivitamins out on the market that you can also consider. Vitamins that are high with lutein, zinc, omega-3s that are found in like fish, dark green leafy vegetables, orange fruits and vegetables like oranges and cantaloupe. All those are high in the nutrients that are found as protective against macular degeneration.
I wonder if, I'm just going to throw this out here, the growth in the numbers, I mean, because we're looking at almost double in the next 15 years for people suffering with macular degeneration. Do you think that has anything to do, and it's more in females too, anything to do with tanning beds?
I think it's more having to do with the fact that we're living longer lives.
Oh, okay.
And we are able to diagnose this problem sooner. I don't think it's necessarily so much with tanning beds, not that I've ever really read, but UV is a huge cause. UV and smoking, family history, those are huge factors.
So what do you do if you find out that you have macular degeneration? And again, that's why it's so important to go yearly, because I imagine catching it earlier is going to help you treat it.
Absolutely. Well, there's two main kinds of macular degenerations. There's the wet kind and then the dry kind. Fortunately for most of us, the dry kind is what 90% of people get with macular degeneration. That is usually a very slow progressive condition, and you don't necessarily lose a lot of sight with it. The wet kind, however, it's called wet because there's bleeding in the retina. The bleeding is what causes the vision loss. Unfortunately, with the wet kind, you can lose vision within a couple months.
Wow.
It's done. So it's very important to have that screened. And in my own experience, it's the smokers who get the wet kind more than anything else. There's another reason not to smoke.
And really, there's nothing you can do except that you're diagnosed with it?
Unfortunately,
Wow.
the wet kind, there are some laser treatments that you can have done that help. You know, basically what happens, we don't know why, but the blood vessels in the macula area, they get very weak and frail, and then new blood vessels form, and those are fragile, and then you get bleeding of those new blood vessels. So you can try and stop the bleeding of those new blood vessels. That's what the laser treatments do. The dry kind of macular degeneration is basically just monitored and then treated with those vitamins that I was telling you about and things like that.
And maybe laser too, or no?
It depends if it turns into the wet kind,
I
like the
see.
dry kind could turn into the wet kind, and if that's the case, then yeah.
So when we're talking about 1.8 million people growing to 3 million people by 2020 that suffer with macular degeneration, are we talking more about the dry kind or both together?
I would definitely say both are going to grow, yeah.
Okay. I don't know about you, Allison. My eyes hurt.
And what the listeners can't see is that Jeannie and I are taking notes for ourselves while Dr. Bashir is talking.
Damn it. I don't like middle age.
And I hope people are listening to you seriously, because my mother suffered an injury to her eye 30 years ago. And they've been working on her eye for 30 years. And last year, she developed the bleeding and the macular degeneration on that eye, and has now lost the sight in her eye. Literally, listen to me, people, lost her sight.
Yeah.
This is not something we can fool around with.
But there's not a lot you can do.
Well, if you're diagnosed...
Except quit smoking.
Yeah.
And
definitely.
eat healthy.
Right.
Everything comes back to living a healthy lifestyle.
Right.
Absolutely every show we do brings us right back to real foods, fresh vegetables, fresh fruit.
Take care of yourself.
Okay. Dr. Bashir's also listed a new disorder that I'm dying to talk about because this is going to trigger a lot. You mentioned computer vision syndrome.
Yes, I mean, it is all the talk in optometry nowadays because, again, we're using the computer, and not only just the computer, any type of near vision task like our phones and our iPads and our tablets and all this kind of stuff. We're doing so much more visual demanding tasks up close than we ever did before. Believe it or not, myopia, so the nearsightedness that I talked about, it's increased from 25% of the population to almost 42% in the last 30 years. And it's being attributed to our use of computers and our up close. You know, we're supposed to be hunters and gatherers. You know, we're not supposed to do all this up close work that we do. Our visual systems are made for far. They're not made so much for up close. So you're straining your eyes when you're on the computer 8 to 10 hours a day. And it's like, most of us do that.
So what do we do?
What do we do is we take breaks when you're on the computer. There's a great rule that I love to follow. It's called the 20-20 rule. So the 20-20 rule is basically for every 20 minutes that you're doing up close work, you look at something far away, past 20 feet, like look out a window. Look at something way far away for about 20 seconds to relax your focusing muscle. Then go back to your work. So that doesn't mean work for 5 hours, take a 5-minute potty break. That's not what it means. You have to relax your focusing ability on a regular basis. Also, making sure you've got good light in the room. Make sure you're sitting up. Make sure your computer screen is at a good, comfortable distance. Make sure that if you need glasses or something to see up close, that you're wearing them.
Yeah, that would be good.
Yeah.
I have also noticed along the lines of computers, people scroll quickly when they're looking for something on the computer, and I am one of those bad people who does that. And I will notice that I actually feel dizzy from time to time.
You're going way too fast. Another thing at the computers people don't realize, your blink rate goes down by half when you're on the computer. So guess what happens? You're not blinking enough? Dry eye syndrome.
Your eyes get dry. Yeah.
Your eyes get really, really dry.
Huh.
So you got to remind yourself that you got to blink.
The things that we don't think about.
Is there a limit of time that you tell your patients this many hours on the computer and then you really need to stop for the day?
You can't do that.
You can't.
It's just not realistic.
Mm-hmm.
But I do try and tell my patients to follow my 20/20 rule and take a break every 20 minutes. Even if you have to set yourself a kitchen timer for the first couple days till you get in the habit of doing that, do it. It'll really save your vision.
Good information. Thank you so much, Dr. Bashir. Again, let's tell the folks where you are located, how they can reach you if they have any questions or want to come and see you.
Sure. My husband and I have 3 offices. We're with UNM Family Eye Care. We have offices located in Suwanee, Hamilton Mill, and Commerce. You can reach me in email with Dr. Bashir, DRBASHIR, at umicare.com, or my office, 678-482-0572.
Great. So we've talked about dry eye and computer vision. I remember
Syndrome.
CVS syndrome and cataracts. I now want to talk about the dreaded word glaucoma.
Sure.
What is glaucoma?
Glaucoma is the second leading cause of blindness in America after macular degeneration. With this disease, you have an increase in eye pressure in the eye, a gradual increase in eye pressure. And there are no signs or symptoms of this condition early on. Nothing. What happens with the increase in eye pressure? You get a compression of the nerve in the back. When the nerve in the back gets compressed over time, you lose your side vision. What people don't realize, we have 2 eyes. Our visual fields overlap. So if you're losing your side vision, you're not going to realize it because your other eye is going to compensate.
Huh.
So that's why this is such a deadly disease.
It's a compression literally in your back, not in the back of your eye?
In the back of your eye.
Oh, okay.
In the back of your eye.
I was getting a little
scared. And there's no pain. It's not like you're going to feel like, oh, my eye feels like it's sore, or I feel like there's pressure in my eye. In the majority of cases of glaucoma, you feel nothing.
And how does it happen? It just something that happens with age?
Again, family history. It's more prevalent in the African American population, also more prevalent again in Hispanics. Family history, diabetes. If you're diabetic, you're at an increased risk of glaucoma. Steroid use. If you're in the hospital for other reasons or needing to use steroids for a prolonged period of time, you can get a highly elevated pressure in your eye. So those are the main causes.
And no real symptoms. So again, the importance of getting your eyes checked every year, especially if you're diabetic. I imagine that diabetics do take better care of their eyes because they're told.
You should hope so.
Yeah, but there's a lot of non-compliance out there. And so say someone does have glaucoma. It's hard to catch because there's no symptoms, but they're being responsible and they're coming to their optometrist once a year. You find out they have it. What do you do?
It's very easy for us to catch it. So a regular eye exam, we usually catch it very, very early. So the tools and the techniques that we have in the office, again with the dilation, you can have a visual field test, a side vision test, which is an early indicator of glaucoma. You have the air puff or a pressure test. That's also a screener for glaucoma. So if you are diagnosed with this problem, guess what? It's super easy to treat it.
Really?
In most patients, all you need is a drop once a day. That's it.
For how long?
For the rest of your life.
But still, it's the second leading cause of blindness. So if you go to Walmart and see your optometrist and it's caught, you put a drop in your eye every day and you don't go blind.
That's exactly right. Simple as that.
this just goes back to what I keep saying. People take their eyes for granted. And this is a disease that shows no symptoms early on. And it's so easy to treat. Why wouldn't everybody go in once a year and have this checked out?
That's exactly right. You hit it right on the dot.
This is our vision. And we're all so hyped up on working to be healthy, and everybody's jogging and everybody's eating the right foods, and yet we're not checking our eyes.
And is there a typical age onset for glaucoma?
Usually it's after 40.
It is.
But I've seen it in young kids as well. But those are usually with a very strong family history. Like the mom and the dad both have it.
And how long does a typical eye exam take?
It takes about 30 to 40 minutes. That's it.
Because I was thinking of leaving the studio and following
Come
you.
on over.
I'll see you at the office later.
Let's go. Carpool.
All right. Well, we're running out of time. We always do. There's never enough time. So top 3 things you want the audience to know about eye health and you as an optometrist and what you see.
I think just the top things for everyone to do is to, number 1, of course, go get an eye exam every year. Make sure that the doctor is screening for glaucoma, diabetes, macular degeneration, cataracts, all the things that get done with a complete, thorough eye exam.
And they don't necessarily always do that, so you really have to ask those questions and be your own advocate?
You can. Most legitimate optometrists, ophthalmologists definitely do screen for all those things. But I feel like you need to advocate for yourself.
I see.
So you going in there need to be an educated patient as well. So you need to make sure that all these things are getting done for you.
The whole point of this show, Better Living. We want to inform and educate. All right, wonderful. And anything else? Annual eye exams, advocate for yourself.
Take care of your vision, give yourself breaks when you're on the computer. Make sure that you know what your own family history is. So if you do have a family history of macular degeneration or the like, that you come into your optometrist's office saying, hey, I have a family history of this. So we're more aware of that as well.
Wonderful. Well, Dr. Bashir, great information, especially this time of year, especially for me.
I'm going home with a whole list of notes.
Thanks for joining me this week, Allison.
It's been my pleasure.
I'm Jeannie Pete. Thanks for listening. Have a blessed day and week ahead. And listen here, same time next week and every week. Homestead Hope Foundation is your resource for a healthy life. God bless.